Okay, awesome, great. So welcome to One Million Cups. We are going to get started. Next slide. There you go. So just for a quick overview, we're going to go over the history of 1 Million Cups, and then we're going to have our featured presenter, and then we'll go for 2-minute Q&A afterwards, and then just some closing statements. So 1 Million Cups is brought to us by the Kauffman Foundation. The Kauffman Foundation works with communities, entrepreneurship, and education to increase opportunities that allow all people to learn, take risks, and own their successes. 1 Million Cups is a free weekly program that educates, engages, and connects local entrepreneurs. Our mission is to lower the barrier of access to education, resources, and connection for all types of new and aspiring entrepreneurs throughout the United States. So it started in 2012 in Kansas City and has grown to over 200 communities, each of them having 1 to 2 presenters a week. And we meet every Wednesday at 9 a.m. on Zoom and here at Stone Coffee. If you would like to join our community, feel free to follow our chapter on the 1 Million Cups platform at 1millioncups.com/Chico. And today we are having Harini Kumar from BrainScanology, and she's going to present. Are you all ready, Harini?
Yes, I am. Let me start my screen share. All right. Then please tell me if you're able to see it.
Yeah.
Yes.
Perfect.
Yes. Okay, great. So hi, everybody. My name is Harini, and I'm the co-founder and COO of BrainScanology. And we're basically the 23andMe for psychiatric disorders. So that's Alzheimer's, dementia, bipolar disorder, and schizophrenia. Thank you all so much for being here with me this morning. I couldn't be more excited to share, what we're building. And before I get started, I actually wanted to say I have 2 of my teammates here with me, Dave and Van. And so Q&A, we can get as technical as we want. So let's get right into it. I wanted to kick things off by talking about what we're able to provide for patients. So through customer discovery interviews and talking to clinicians, we were able to discern that oftentimes patients really struggle with understanding where and how to get a diagnosis for a psychiatric disorder. Till now, there wasn't really an objective method for early detection. Our risk assessment is meant to be a supplement to a clinical diagnosis. So since it takes less than 24 hours for our algorithm to process the MRI that's submitted, will significantly decrease the amount of time and resources needed to accurately diagnose a patient. In many of our customer interviews, we did identify that one of their biggest pain points is that, the diagnostic process being long and emotionally taxing. And so our service is the perfect solution for truncating such an emotional and lengthy process without sacrificing accuracy. One of the main points I want to emphasize on this slide is that BrainScanology's algorithm is truly going to disrupt how MRIs are analyzed. Now, I want you to think, about how we've always measured shape, which is by using only area and volume. BrainScanology's algorithm is built by measuring shape in an entirely different way. This diagram shown here demonstrates why we need an approach like ours. So this is actually the level of sensitivity necessary to gather information from biological shapes, because they're not as straightforward as a rectangle or a square or a circle. So let's take a look at the total addressable market. In the USA alone, we've calculated that the total market is estimated to be about 25 billion. There are 38 million MRIs performed in the US alone, which are mostly done through hospitals and independent imaging clinics. And so these statistics that you see here are unfortunately expected to grow exponentially in the coming years. And so it's more important now than ever to implement a speedy, precise, and accurate early diagnostic method, and BrainScanology fits the bill. Now, I wanted to talk a little bit more about our value add and why hospitals and healthcare providers would actually even want to partner with us and purchase our service. Who wouldn't want to keep billions of dollars in their pockets? So once disorders like Alzheimer's or dementia are developed, they are extremely costly to treat, especially from a healthcare provider's perspective. And so the cost benefit that we've actually calculated for institutions like Kaiser is that they'll be saving around $1,000 per patient per year. And so that's just for Alzheimer's alone. So that actually saves around $11 billion a year just for Alzheimer's and dementia patients. In terms of competition, we do currently have a few competitors, only one of whom is FDA approved, but all of our competitors actually only focus on Alzheimer's. So BrainScanology's positioning is quite differentiated from them, given that not only do we specialize in multiple disorders, but also in that our diagnostic approach is entirely different and much more sensitive. So let's take a look at our financial strategy. I'm happy to say that we were able to raise a total of $165K on WeFunder, which is a crowdfunding platform, in early 2021. And we also just recently closed a round of $700K in seed funding from Go Ahead VC. And so that was in September of 2021. We are currently looking to raise $3 to $5 million in our next round of funding. And so in terms of revenue, we are also currently selling limited lifetime subscriptions at a discount price in Chile. And so in a few months, we are also planning to apply for SBIR funding from the NSF and the NIH. And that's really going to provide us with non-dilutive funding. In terms of our short-term business model, in the last 6 months, we have learned that we can begin taking pre-orders in Latin America while we work towards FDA approval in the United States. So the model we're using is a scarcity subscription model in the short term, and launching in Latin America does also help us promote our interest in diversity and inclusion. The more Latin American MRIs we receive, we'll be able to generate models that are accurate for their specific population. Yes, and so BrainScanology's FDA approval. So our approval process will be expedited. We'll be going through the 510K pathway. The 510K pathway is expedited just because there is no clinical trial requirement, and we do have a predicate product, which is called Core Insights by ADMX Diagnostics. However, we will require a de novo pathway for the full scope of our original diagnostic software, which could take 2 years. Ultimately, our long-term business model is B2B. We will sell our service at a discounted price to health providers, insurance companies, university hospitals, employers, and even police and firefighter unions. Our aim really is just to ensure that there are multiple channels through which people can sort of have access to our service. Yeah, and like many startups before us, our exit strategy is ultimately acquisition. We plan to be acquired by, a company that is a major market shareholder in the diagnostic and imaging industry, such as Hitachi or GE Healthcare. And GE Healthcare is actually one of the biggest manufacturers of MRI machines. Our exit strategy was derived from adjacent industry exits that have set, that precedent for us. So players like Fujifilm, Canon Inc., Siemens, and GE have actually acquired either diagnostic businesses or imaging systems that were pioneers in the industry, very much like ourselves. A very quick overview of our timeline. As mentioned, we did launch pre-orders for our service a couple months ago, and we're now gearing up to apply for SBIR funding. Next in the pipeline for us is to use, our next round of funding to hire across all our teams, refine our models further, and begin the CE marking process. And after a few more rounds of funding in the next 2 to 5 years, we do hope to make our exit. All right, and so I think that's it from me. And I did want to thank everyone so much for the opportunity. And I'd love to answer any questions you might have.
Give a round of applause.
So I'm going to do some questions. Does anybody have any questions before I ask mine.
Yes, I do. So hi, Harini. I hope you can hear me because we've had kind of a harsh internet connection. But thank you so much for your presentation. My first question has to do with your second slide, where you're showing the images. Because you broke up, I want to ask a question about those images. Were they images of brain plaque?
So yeah, Dave can actually take that answer while I pull up the slide so that everyone can see.
Hi, yeah, and so the images were not of brain plaques. They're actually the outline of what's called the Sylvian Fissure. So that there's I guess a cavern right here above your ear, inside your ear, that separates, the temporal lobe, from the lobe above it, right? And so that's the Sylvian Fissure. And in Alzheimer's, that area enlarges because your whole brain is shrinking, right? And so what this shows on this slide is just the outline of the shape of that cavern in 2 dimensions, right? And yeah, and the thing is that if you see that if you look at the MRI scan by the naked eye, it's really hard for the eye to see this, right?
Yeah.
And so we, just for a visual effect, we laid them side by side so you can see that, oh, actually when you lay them side by side, you can actually sort of pick it out, in general. But our technology precisely and measures this very accurately, the difference.
Interesting. Okay. My next question has to do with the algorithm for analyzing those shapes. How long is that, and excuse me if I missed that part, but how long has that been in development?
And so I've been developing that for, let's see, 4 years now. In terms of, I invented it. I've been working on algorithms for 4 to 5 years. It was invented, this algorithm, 2 years ago. We've been applying it on brains, including Alzheimer's disease, about 1.5 years, 2 years into it. Yeah. Mm-hmm.
All right, great. Well, congratulations. Are you going to be filing a patent for this, or do you already have patent pending?
Yeah, the patent is pending. Definitely, we wanted to move forward with that before we did anything else, just to protect IP. Yeah.
Okay, and the last thing is a comment, not a question, because I'm hogging all the time. And that is really glad to hear you guys are going after SBIRs. So I involved in that kind of stuff as well, and it's really great.
I have a question in the chat currently. How early on in a person's life does this measurement process take place?
So I guess the short answer to that, it's different for every disease and disorder, but I think Dave can probably provide a little bit more clarification on that.
Yeah, so I just responded to Heather's question. It depends on the disease. For Alzheimer's, typically, in your mid-50s, right? That's typically the early onset. But that depends on if you have a family history and how many people in your family have that. There's a very strong genetic component to all psychiatric diseases. So for bipolar disorder, right, typically, if you have a severe case, by the time you're like 13 to 15, you'll know, right? But typically, median onset of diagnosis is 25. That's the magic number. And our research shows that, yeah, the brain dramatically changes once it hits that 25, right? Pretty amazingly, right? And so it sort of makes sense why, the average or median age of diagnosis is 25. So it depends on disease. Of course, ADHD and autism, much earlier on, right? In severe cases, you'll know by the time you're in elementary school, right? And so the cool thing about our technology and what sets us apart from the rest is that our technology applies well to all major psychiatric diseases, and so we offer services that span the full human lifetime, right, from several years after birth to the elderly years.
Dave, do you see this as something that, and probably not, but would be eventually covered by insurance? I mean,
yeah, and definitely, Harini can speak to this, but yeah, in order for us to have contracts B2B with major health providers like Kaiser, they would have to integrate us into their system just like any other diagnostic tool.
okay.
Yeah, exactly. And just to add on to that, our value add is for both insurance companies and healthcare providers, just because not only are we saving them a lot of money, but early diagnosis in general is just one of those best practices and generally just smiled upon. So, we're hoping to get those contracts in place. And then I know there are various health codes that we will need to look into. And so we're going to go into that process once we've sort of gotten a handle on our tech development. All righty. And so in the chat, Dave, we are being asked, since it's similar to 23andMe, would this be a test you need a doctor to authorize, or can a customer seek this out independently? Super great question. I did mention that, so our service is going to be a supplement to a clinical diagnosis. And so why we pursued Latin America in the first place is because they don't have a lot of regulatory roadblocks. And so that just means that we can kind of reach the independent customer and consumer, just directly. But in the US and other countries, it is going to be a little bit more difficult, which is why B2B is the business model we've chosen, and it probably has the best success rate. And so, yeah, a customer could seek this out independently if they wanted to. It's just we would pair it with a clinical diagnosis.
Yeah, I'd like to add that that's a good question. At this point, no diagnosis will, at least for complicated diseases like psychiatric disease, will completely replace a clinician's opinion, because there's so many different diseases and conditions that cause similar symptoms, right? And so there's something called normal pressure hydrocephalus. That is, there's excessive pressure in your brain, and it causes similar symptoms as Alzheimer's, right? So your psychiatrist can't just say, oh, you have symptoms of Alzheimer's. I did 2 behavioral tests, therefore I'm going to give you a drug for Alzheimer's, right? I mean, that drug has side effects. You know what I'm saying? And so the psychiatrist has to, that's why it takes time to, tease apart and eliminate things that, are similar. I think of the headache, right? Or depression. A lot of things can cause headaches, whether, you have COVID or you have the flu or you're dehydrated, right? And so a psychiatrist has to, or a clinician has to pick that out and can't just give you anything, right? And so therefore, we train our models, and all companies do this right now, AI. We train our models based on very specific curated data, right? That we know that this is Alzheimer's for real, right? But in the real world, it's more complicated than that, right? And so therefore, all technology at this point, will not, for psychiatric diseases, that is, will not replace a clinician's opinion.
Great, thank you so much. Was there any other questions?
Yeah, I might have missed this, but where's our headquarters?
Where's your headquarters located?
So until now, we did have space, office space in the WeWork at the downtown Berkeley location, but currently because of COVID and other conditions, we are working from home. All 3 of us, Van, Dave, and I, were all located in the East Bay. So I myself live in Dublin. That's where we're incorporated. Dave lives in Walnut Creek / Concord area, and Van lives in Fremont.
Okay, awesome. Okay.
Van, why don't you introduce yourself? I guess we did. Van is our CTO, came on 2 weeks ago, and so I guess his picture hasn't made its way onto our slides yet. But go ahead and introduce yourself, Van.
My name is Van Pham. I have been a database engineer for about 30 years. For the last 10 years, I've been working as an engineering manager. I work at a variety of different companies where I help scale the companies to meet millions of transactions. And my latest company was Venmo, where I was there for 4 years, helped scale Venmo from the time I joined, where we were processing somewhere around 31 billion TPV, transaction per volume. Until the time I left, we were processing around 400 millions. And my team is responsible for scaling the database platform to meet that requirement. And I'm glad to be here.
Thank you for being here. We have another question in the chat. How many employees do you have, and what is your staff growth plan?
Great question. Yeah. So right now, our employees in the US are the 3 of us, and we have 4 interns right now. Most of them are from UC Berkeley and UC Davis, from institutions in the Bay. And so they help with a lot of our R&D and our business development. And in terms of engineering, we do have 2 engineers out from Pakistan. And so they do help with the R&D, and they're very heavily involved in the development technology in general.
Since you guys have interns from UC Davis, have you guys thought about applying for and participating in the Big Bang competition?
Yeah, exactly. So I am actually an MBA student at UC Davis. I'll be getting my MBA in a few weeks actually. So as I was wrapping up my program, the Big Bang did cross our path quite a few times, but we have actually raised more than the threshold amount. And so we do not qualify to participate in Big Bang, which is a sort of sweet problem to have, but yeah, great question.
Yeah, I didn't even think about that. You're right. Well, congratulations on raising so much money then.
Thank you so much. Yeah, thank you.
Let's see. Did anyone else have one? Do you have another one?
Oh, I could keep going, but no, I don't want to talk about it.
Do you have one, Gunnar?
Honestly, it's a really, really solid plan. I mean, very, very well thought through, and it's very polished. So, I mean, props to you guys on that.
Yes, we definitely appreciate you guys coming out and presenting today. Yeah, go ahead.
So you were talking about it might roll out in Latin America, and there's not as many regulatory hurdles there. So if somebody from the US wanted to go to Latin America, is that an option? And I'm just kind of curious what the price point would be.
Yeah, so I think as far as the regulatory law goes, we have set up, a Latin American site just for Chilean. So Chile is the country that we have launched in so far. And so it's a separate website altogether. All the advertising and stuff is done to target just Chilean citizens and people with a Chilean address and things like that. And so even to pay for the service, they have to check off a box in the terms and conditions section, and it does require a residency in Chile and also several other factors. And so we have a law firm down there, and so they have helped us sort of work out any possible workarounds that people might think of to get access to our pre-orders.
Fantastic.
Yeah, thank you.
Yeah, as a follow-up on that, I was looking at social media or a website, and I found the website in a different language. So are those the two main outlets that you guys have, or your two websites?
Yeah, we have those two websites. We do have a Facebook page in both languages. We have Instagram pages for both as well. And then LinkedIn is in English only so far.
How many people do you currently have on the ground in Chile?
It is a team of 3. So we have a marketing agency, and so they're local in Chile, and so they work on all the campaigns, our graphics, just all of the marketing content. So even the follow-up emails, just all of that is done locally by them.
I'm gonna guess that they're contracted with an MRI.
Do you have any contracts down there as well?
That's a good question. So we actually are in the process of getting some contracts down there, at least in the way of partnerships. So some of our, marketing agents, so they're actually helping us, contact these psychiatric professionals, people from independent imaging clinics, and just, professionals that we would want to partner with. Something that we've learned from all these marketing agencies and, different people in Chile is that having the, vote of confidence from a key opinion leader is very, very crucial to the success of a business, let alone, our marketing campaign. And so we've been on the search. We're talking to a number of individuals right now, just, in the process of talking to them about our technology and spreading the word and just getting feedback and advice from them and seeing whether it would be something that they would implement or not.
Amazing.
Awesome.
Great, thank you so much.
Yeah, congratulations again. This is great.
Thank you so
sign
much.
up for-
And
Good to hear.
and if there are a number of questions, I'd like to add one more point since this is being recorded in case somebody comes across and is interested. So our tech right now, so AI is only as smart as what you feed it, and data bias is a problem in all AI, especially in biomedical science. meaning we have fewer samples for females, and we have fewer samples for ethnicities other than non-Hispanic whites. And so therefore, all models would be biased towards males who are non-Hispanic white. And so what we're finding now, we have access to MRIs thanks to Sid O'Brien. He's a professor at University of North Texas who studies dementia in Hispanic Americans compared to non-Hispanic whites. And he shared data with us, and our technology is finding that there are drastic differences between Mexican American males and females compared to non-Hispanic whites, and therefore we need.
If they were.
Go ahead. I'm sorry, I think you cut out. Somebody said something? No? Oh, okay. Well then, yeah. And we're finding that we have to build, AD, Alzheimer's, these specific models for each ethnicity, right? And we're because our technology is so sensitive compared to measuring volume and area, and that we're the ones poised to really make a breakthrough in this area in terms of accuracy and speed, right? We just need fewer samples to get an accurate model compared to the legacy approach, right? Which is, area and volume. And so we're very excited about that in terms of, what we're able to do. By 2060, 1/3 of the United States population will be Latinx, right? And yet our best markers right now for Alzheimer's, genetic markers, don't work well because what we find is that those markers were discovered in non-Hispanic whites, and a lot of that just doesn't apply to Hispanic Americans.
Job one more. All right, we'll go ahead and wrap it up here.
Yeah, all right. So thank you so much for our presentation. I am your host, Chanel Hamilton, and our chapter lead is Steve Shepard, and our IT people today are Perez and Logan Sullivan. And we also want to thank our community sponsors, Morgan Stanley, Chico Start, GrowTech, Global Entrepreneurship Network, T-Bar, Build.com, Startup Grind, Explore Butte County, and of course, Global Coffee.
I have a question really quick. Sorry to interrupt, but I'm not, maybe you'll ask this, but I was thinking like, how can our community help you guys? Chico is a population of 100 plus, and in Butte County, and just wondering after this presentation, what can we do to help you guys, get the word out and all that?
Yeah, great question. So, like Dave mentioned, we are in the business of machine learning. So having access to institutions that can share MRIs, that would be really beneficial for us. And also, as I mentioned earlier, we are fundraising right now. So any warm introductions to potential investors, maybe even meet and greet events, that would be wonderful.
Thank you. Thank you so much.
Thank you. Yeah.
Thanks, Heather, for the question. Go ahead.
And then obviously we need to change this, and we are presented for next week, but we will have a presentation next week. You guys would like to join us and scan a QR code to join our newsletter. So thank you very much for.
Let's give them one last round of applause.
Yeah, let's sign up.
Thank you again. Hope you guys have a great day.